Hello, everyone, and welcome to this audio podcast today. This audio podcast is part of the Cytometry Cyclone. This audio podcast is part of a Rakas and Bombard episode, and this audio podcast as part of a Storm Robotics production. Those who have been listeners and viewers who've been checking out this episode, this Rakas and Bombard episode will hopefully uh, um, will hopefully now be aware in around the aspects around the RPSG, the renal patient support group, the RPSG and the kidney disease and renal support group, and KDAR's social media platform for kids. And so in this audio podcast now to look at some discussion and conclusion, sort of drawing in aspects of this series or this episode to a close. One of the main mechanistics or mechanisms to support healthcare service users and healthcare professionals or healthcare service providers is to take a greater intrigue surrounding in the integrated aspects of scientific practices in around solid organ transplantation, and have been sort of so which have been sort of informed in as part of this in as part of this as part of this audio podcast sort of episode. At the same time, these sort of the sort of scientific practices, aspects around the scientific practices have included a sort of public health initiatives aimed at integrating shared decision or informed decisions, wherein healthcare service users and healthcare service users and healthcare providers through aspects of, for example, initiatives additionally such as patient and public involvement and aspects in context of research and in context of the National Institute of Healthcare Research, or NIHR, and sort of in around the NIHR, that this then sort of prompts a sort of a sense of co-development to increase the number of healthcare decisions where both healthcare service users and healthcare service providers are involved synonymously or in synchronicity. Investigations in context now of the role of immunobiological sort of receptors, for example, in around chemokines and cytokines, and the mediation of acute allograft rejection research and works is challenging, primarily because of the sort of unsatisfactory nature of laboratory representations or investigations that are in around acute allograft rejection. However, at the same time, social media platforms as space have importance and prompt inclusive healthcare practices, and thus invite healthcare service users, healthcare professionals, and researchers to co-develop between academia and healthcare practices. In around the conclusions, the importance of decolonization of immunobiological practices and laboratory medicine, including sort of in around the patient perspective surrounding serological investigation, have not been conveyed been conveyed within literature or published works in any specific detail. So to decolonize and diversify such healthcare and scientific themes surrounding evidence-based practices through social media should, however, implement and encourage patient and public involvement, or PPI and laboratory medicine and clinical practice alliances, somewhat relating and regarding again in around the RPSG, the RPSG and KDOS social media platforms, which have which are in around in sort of more recent works have published works in around in around works that have been referred to as topic tagging research to inform what kidney disease healthcare themes are most pertinent or important to healthcare service users, but also by way of bridging healthcare disparities and inequalities, prompting a more inclusive sort of frontline and a more inclusive frontline and healthcare practices. Finally, it is also important to sort of appreciate and recognize that healthcare service providers, academics, and healthcare service users tend to have different motivations to challenge disparities when encouraging sort of best practices surrounding healthcare and healthcare services. Patients tend to have varying skills, tend to vary in skills, or have varying skills, or and sort of not around skills, as well as knowledge, and the confidence to approach aspects in around healthcare. One example would be to envisage healthcare service users and healthcare professionals who are determined to co-develop and integrate healthcare services, to also envisage quality collaborative efforts. Both RPSG and KDOS social media platforms, for example, have prompted integrative practices highlighting the importance of highlighting the importance of healthcare service users and co-developing works such that for example, aspects in around transplant immunobiology, and in around in around the serological investigations are better understood and appreciated at public health level. That draws this audio podcast to a close. This audio podcast as part of a Cytometry Cyclone. This audio podcast as part of a Rakas and Bombard episode, and this audio podcast as part of a Storm Robotics production.